Picture this. Man paralyzed from shoulders down. Swimming accident, can't move hands, can't type, can't play games, nothing. Doctor puts tiny chip in his brain. Week later, playing video games, moving cursor faster than you move yours. Typing messages, browsing internet, all with thoughts. No hands touching anything. His name is Noland, 29 years old. First human ever with working brain computer chip. He's not in lab doing tests. He's home playing Call of Duty. With his mind. That's brain-computer interfaces. Today we're breaking down how 4 companies racing to put chips in human brains, why one co-founder left Elon Musk to build safer version, and whether we should even be doing this at all. Now let's get into it. The race to control our brains is heating up. Quick note, this info comes from multiple sources. If something's wrong, drop a comment. We make economics so simple that anyone with zero knowledge can understand. It's human brain. Most complex, least understood part of human body. Your thoughts, memories, personality, all reside here. Since 1970s, scientists dreamed connecting human brain to computer. This kind of brain-computer interface would help those with disabilities, bypass damaged nerves, restore lost senses, maybe even provide enhancements. 21st century, several startups racing to build world's best brain implant. For better part of decade, Elon Musk's Neuralink at center of conversation. But now, 2 rivals rising up, one led by ex-Neuralink co-founder. Even more interesting companies entering space, growing industry kind of going under radar, brain-computer interface, or BCI, exactly what sounds like. Technology allowing users controlling computers using only brain activity. Sounds like science fiction. Functional BCI's been around 30 years now. Recording brainwaves goes back 1924. Discovery of brain's electrical activity? That's EEG, electroencephalography. Predominant method. Measuring brain activity, you might heard cochlear ear implants. Help people hear again by stimulating auditory nerves in brain, or seen ALS patients using EEG headsets controlling devices with mind. Both examples, early BCIs. But early generation systems suffer fundamental limitations. First, bulky external devices with clunky hardware sitting outside body. Second, only offer low bandwidth connections, can only capture crude basic brain signals. Dream was always something more elegant, discreet. Direct high bandwidth connection to brain, like eavesdropping directly into neurons' conversations. Device reading rich, complex signals of brain activity, translating into precise digital commands real time. 2016, that's exactly what Neuralink set out building. Founded by Elon Musk and team of 8 engineers and scientists, wanted designing next generation BCI unlike anything world ever seen. Awkward academic prototypes wouldn't cut it. Wanted something commercialized, improving quality of life for millions. Result was brain implant known as Link. Device had 2 parts. One coin-sized transmitter implanted into skull sits, flush with surface. 2-part actually goes into brain tissue. Set of 1,024 electrodes distributed across 64 threads, thinner than human hair. These threads penetrate into brain tissue about 3 to 5 millimeters deep. Link chips implanted by surgical robot, also of Neuralink design, known as R1, makes implantation process scalable. R1 robot inserts threads into brain with speed and precision not possible traditional brain surgery. Think of threads like tiny microphones listening to neurons. Except instead of sound waves picking up electrical signals, each neuron firing sends tiny electrical pulse. Threads detect these pulses, send data to transmitter. Transmitter sends wireless to computer. Computer translates signals into commands. But Elon and team didn't stop there. Made sure Link was bidirectional, meaning could read as well as write brain signals. Practical terms, Link would decode paralyzed person's thoughts, sending email. Also, able stimulating user's brain with own signals. For example, could theoretically stimulate blind person's visual cortex, helping them see without eyes. Possibility Elon Musk shared 2025 talk, said, quote, Neuralink has had in monkeys working device we call blind sight, working well monkeys, healthy for few years. now hoping later this year, do first device implant for human, enabling someone completely blind to see it's going to be low res, at first like Atari graphics, end quote. When stop and think about it, sounds far-fetched, but similar concept to cochlear ear implant, artificially stimulating brain using external stimuli. Although restoring vision, probably order of magnitude more difficult than sound, clear potential medical applications endless, restoring movement to people with spinal cord injuries, restoring vision and speech, further downline relief for depression, improving memory recall in dementia patients, so on it goes. But Neuralink's real vision, rather spicy, goes far beyond healthcare. Musk talks a lot about unlocking human potential. Device eventually enable telepathy machine control, putting humans into, quote, symbiosis with artificial intelligence, end quote. August 2020, just 4 years after formation, Neuralink showed device implanted into pig recording neural activity from her snout. Following year, showed macaque monkey playing Pong using only thoughts, company crushing milestone after milestone. Finally, January 2024, Neuralink installed first brain implant into human patient, 29-year-old quadriplegic Noland Arbaugh. Swimming accident, left unable moving from shoulders down. Friend, longtime fan of Elon, asked if, quote, wanted chip and brain end, quote. Despite knowing he'd be first test subject, said yes without hesitation. Quote, it's always cool to be first at anything. I think anyone given that opportunity would probably do it, end quote. That was Noland, 2024 interview. Noland's implant embedded left motor cortex, specifically part correlated to right-hand movement. Through Link computer app, chip translates Noland's thoughts to cursor control. Results remarkable. Can move cursors, play games, text with unprecedented speed precision, all looking promising, great even. But few weeks after landmark surgery, everything started unraveling. Not even 1 month after receiving implant, Noland informed 85% of Link's electrodes retracted from brain no longer responsive. Fortunately, didn't have undergo another surgery. Software update fixed most problem. But deeper issue here? No one from Neuralink warned Noland about potential risk. Even though companies seen similar problems in animal trials on monkeys, other test species, not first controversy-plagued company. 2023 FDA cited Neuralink's animal testing facilities having, quote, objectionable conditions, end quote, includes quality control issues, poor record keeping. Some reports revealed several monkeys died due complications from Neuralink brain implants. Perhaps most telling sign trouble wasn't external investigation. Internal disagreements caused one company's own founders stepping away. Dr. Ben Rapaport, extremely accomplished neurosurgeon, electrical computer, biomedical engineer. Interview with Wall Street Journal says, quote, in early days of brain-computer interfaces, there was notion that in order to extract information, rich data from brain one needed to penetrate brain with tiny needle-like electrodes, end quote. This implementation method, which Link relies on, leads one serious side effect. Always results some amount of brain damage. When threads inserted into brain tissue, create scarring, sometimes even rejected by body. When scarring occurs, electrodes can no longer read brain signals. Exactly what happened to Noland. However, Ben Rapaport thought about problem differently. What if safer, less invasive way getting high quality data? This clashed with Neuralink's approach. Over there, not so concerned about invasiveness, clashing of heads. Internal disagreements culminated with Ben leaving company just 1 year after public launch. 2021 founded rival company, Precision Neuroscience, with co-founder Michael Megan. While seemingly operating same space as Neuralink, Megan emphasizes Precision Neuroscience's mission inherently human care focused, none of that Elon Musk flavored merging with AI stuff or superfluous human enhancement. Fundamentally different missions. If look at Neuralink's website, stated objective create some sort symbiosis between human intelligence, artificial intelligence. Fine goal, maybe important one, but not our goal. Ben is neurosurgeon, physician-led company. Really built into DNA, focus on safety patient impact. Goal of company, make really meaningful positive difference in people's lives. Precisions. BCI layer 7 cortical interface also array composed 1024 tiny electrodes, but instead being implanted into actual brain tissue, thin, flexible enough, conforming shape brain tissue, kind like cerebral glad wrap, film 1/5 thickness human hair, doesn't create any damage scarring risk rejection by patient's body, also means easily removable. Fact precision, neuroscience focused, creating temporary implant used up to 30 days. Another key difference where transmitter lies. While fitting Neuralink link requires permanent modification patient's skull. Precision, neuroscience came up much more elegant solution. Place transmitter under patient's skin instead. Once removed, hardly able, tell patient had it aside from couple stitches. Less invasive procedure means researchers can place multiple arrays, same patient's brain, simultaneously. To date, managed placing as many as 4 arrays or 4,096 electrodes on patient's brain, same time. CEO claims this world record. Precision completed human pilot study, implanted devices in patients undergoing brain surgery, then recorded brain activity real time, provided highest resolution, picture human thought ever recorded. President Chief Product Officer said interview with CNBC, quote, "It was incredibly surreal nature of data. Our ability, visualize that I got chills," end quote. Even though precision neuroscience offers clear advantages over Neuralink, their third contender takes least invasive route. All Synchron, founded by Dr. Tom Oxley, created BCI device, doesn't require any brain surgery at all. Instead, Synchron stent road delivered through blood vessels. Catheter threaded through circulatory system up to blood vessels on brain surface. Device unfolds like stent. Actually, same procedure used treating strokes. Minimally invasive, well tested, like installing tiny antenna inside blood vessel near brain. Antenna picks up signals, sends wirelessly to computer. Think of it like Wi-Fi router. Doesn't need plugging directly into wall, just needs being close enough picking up signal. But of course there's trade-off. Signal quality less by sitting in blood vessels rather than directly on brain tissue. Synchron's device captures less detailed neural information compared to other two. That being said, for basic functions like controlling computer cursor sending texts, operating smart home devices, signal strong enough, Synchron already achieved permanent implants in 10 patients, received FDA approval, longer-term clinical trials. Approach represents safest entry into brain-computer interfaces, lowest surgical risk. But let's turn things up a notch. What's race with only 3 participants? One more company should look at. Recently made breakthrough, Blackrock Neurotech, founded 2008, one of oldest, most experienced BCI companies on market. I know what some might thinking, Blackrock and brain-computer interfaces don't go together, sounds dystopian nightmare, despite name. Blackrock Neurotech has no affiliation with Blackrock Investments. Latest chip Move Again system uses rigid grid silicon microelectrodes penetrating cortex, just 96 to 128. Electrodes per array, bandwidth quite low compared to other devices. Rigid structure makes placement less flexible, but not holding them back. Device enabled paralyzed man speak again. Spoke in own voice thanks to technology. Implant reads brain signals as tries speaking, feeds them into AI-powered decoding model. Just 10 milliseconds converted into audible speech created using past recordings patient's voice. Recently implanted 45-year-old man with ALS who really can't be understood when tries speaking. By using BCI can translate desire to speak, have words appear on screen, not being able, communicate so frustrating, demoralizing, like trapped, but can also accurately predict what trying say in free-form conversation. A lot of demonstrations, BCI technology over past decades took weeks, months getting working. First time tried using system, just worked. That first time tried speaking, that word appeared on screen. He started crying, I started crying, family started crying. Everyone had pause, stopped. Rest of experiment trials, everyone composed themselves. All right. Let's do it again. Kept working. Really special. With just 30 minutes, speech training system achieved astounding 99.6% word accuracy. Better than lot commercially available smartphone applications trying interpret voice, which have around 95%. By far most accurate decoding ever reported. That was David Brandman, neurosurgeon, co-leader study. Quote, previous speech BCI systems had frequent word errors. This made difficult for user being understood consistently, was barrier to communication. End quote. This cool and all. But as industry continues growing, which hopefully you can see by now, it is growing, more players enter market. We have bigger question worry about, should we even be doing this first place? Many people feel instinctively uncomfortable idea merging brains machines. Challenges, notion human identity consciousness. On other hand, what does say about us if don't use tool improving lives, those suffering debilitating conditions? Helpful breaking down potential applications, brain implants into 4 categories: treatment, prevention, enhancement, augmentation, treatment, any medical application making patients' outcomes quality life better. Things like helping blind see, prevention, giving BCIs to people, genetic predisposition, different neurological conditions. So far within realm medical applications. But venture into non-medical applications? This is where things get murky. Using BCIs enhance existing traits, augment humans entirely. New ones, a whole different story. If rich parents gave BCIs, some children giving them photographic memory ability, see more colors faster, reasoning skills with actually accurate AI system, does that really seem right? Furthermore, if society eventually divided between enhanced humans, unenhanced humans, what would that mean? Could open Pandora's box eerily dystopian future, like having 2 classes people, those with brain chips, those without? Rich kids get memory upgrades, poor kids don't. Rich kids process information faster, get better jobs, make more money, buy more upgrades, gap widens. Eventually, 2 different species humans sharing same planet. If look, 5 to 10 years future also, legal questions consider. If brain data becomes easily readable, thanks advanced algorithms, who owns data generated by your brain? Where should be stored? What are legal acceptable uses for data? What happens if systems hacked? Imagine powers given to advertisers' governments. If calms any nerves, Precision Neuroscience's CEO says FDA has things under control. Data security, data privacy questions really built into regulatory regime FDA enforces. Highly regulated industry, good reason, not case where companies able move fast, break things. FDA very prescriptive terms, data security, data privacy issues also operate within HIPAA regime. Now for argument's sake, leave aside those disabilities need it most. Where do we draw a line for non-medical applications BCIs? Some will say, never start toying with it at all. Others might think, little bit. Enhancement okay. Unfortunately, at this time where sit very beginning advancement, this kind of technology, no straightforward answer. But one thing, sure. Finding out that answer as technology progresses will be wild ride. Idea merging mind machine, been science fiction decades. As BCIs move from labs into clinics, eventually consumers will all have asked ourselves not just what's possible, but what worth doing. Decisions we make might just define what means to be human. Here's question. Company offers brain chip, makes you think faster, remember everything, never forget. Face name conversation, costs $50,000, rich people buying it, their kids smarter than yours in school. Do you save up buying chip or let your kids fall behind? Don't forget to subscribe so you don't miss any videos.